episode of HealthFirst, we're joined by Dr. Wendy Knoops, leading GP and women's health and advanced menopause specialist. We're discussing polycystic ovary syndrome, or PCOS, and it's estimated to affect 1 in 10 women in the UK. Today, just after International Women's Day, we're discussing its symptoms, including PCOS belly, treatment, and ways to manage this common condition so those with PCOS can enjoy an optimal quality of life. Good morning, Dr. Knoops. How are you?
Good morning. I'm fine. And how are you?
I'm really well, thank you. It's so great to have you. It's a pleasure.
Well, very nice to meet you. And thank you very much for allowing me to talk to you today and explain a little bit more about PCOS.
Fantastic. Okay, so could you tell us a little bit more about yourself and your work?
Yes, so I work in the UK. I'm a private GP specializing in women's health. So I focus very much on women's health conditions, and I term that community gynecology. So anything related to menstrual health, anything related to hormonal health. And what I tend to do is give women the time and the space to kind of discuss their symptoms, their concerns or queries, and really try and understand what is going on with them at a personal level. So a lot of women can get access to the internet and information online, but then don't know what to do with that and how it applies to their own health. So I help them interpret what's going on with their bodies and then give them the medical advice on what they can do to optimize that so that they can perform better, I guess, at work or at home or whatever it is that they want to do, and look at various treatment options and lifestyle interventions, etc. So looking at the holistic kind of healthcare aspects for women. That's what I do in private practice.
That's great. So let's get started with the questions. So first thing, what is PCOS?
It's a very good question because I still think a lot of women don't know about PCOS. A lot of women are undiagnosed, and it's estimated by WHO that at least 70% of women with PCOS don't know that they have this worldwide. So I think it's an important condition to highlight, and for women to be aware of what it is, and so that they can get diagnosed at an early stage and actually do something with their health to be a bit more proactive and prevent future health issues that may develop with PCOS. But we'll come back to that. So PCOS really is a hormonal condition. So it's classically a female hormonal condition that affects women worldwide. And what happens is an imbalance of hormones. So the main thing that we talk about is an imbalance with androgen, so basically testosterone levels. This is quite often raised in women with PCOS. So um, again, the majority of women will have that imbalance, but again, it varies from woman to woman, very individual how much it's raised. And that leads to symptoms that we can discuss about what happens with that. But also there are other hormonal changes. So women won't be familiar with something called LH, luteinizing hormone, but that is another hormone that can be elevated in PCOS, and that affects ovulation. So it affects when and how we ovulate in our menstrual cycle. So again, that's another feature in PCOS because a lot of women don't have ovulatory cycles. And then there are other hormones that maybe we hear a little bit more of, such as insulin. So having a higher insulin level in some cases, and then developing something called insulin resistance, which then in turn affects your glucose, which we relate to diabetes and diabetes risk. So PCOS really is a hormonal condition, which let's call it an imbalance in some way. But that can also lead to other presentations. So you have symptoms and you have some signs to suggest that you've got PCOS. So there are different ways to diagnose PCOS. Do you want me to go through that at this moment?
Yeah,
Or
sure. Why not? Absolutely.
because I do a lot of talking.
Yeah,
So
no, don't worry. There's lots of
um,
details. It's so interesting to know. Absolutely.
it is interesting because I guess, as I said, a lot of women are not aware, and
Yeah.
they blame maybe some of their symptoms on something else, not knowing that it's PCOS related. So classically, we diagnose PCOS based on three kind of criteria. So two out of the three, if they're present, we suspect that that is PCOS and can diagnose PCOS based on two of the three findings. Now, the first two women probably will be familiar with, but the third one is actually found on imaging, so ultrasound scanning. So the first one is related to menstrual cycles. So um, women quite often have very infrequent, unpredictable menstrual cycles and have long intervals. So they don't menstruate every month, and they can be long gaps. So they can only have a few periods a year, or have no periods at all. Now, the majority of women with PCOS will notice an irregular menstrual cycle. And remember, we talked about hormonal imbalance and ovulation. So a lot of these cycles are what we call anovulatory, so don't have ovulation. And so that leads to fertility issues. So sometimes women present with fertility issues, not knowing that they've got PCOS, and wondering why, there are problems getting pregnant, but that's because they've got anovulatory menstrual cycles. The periods themselves, if they don't happen that often, that also, again, I'll come back to risk factors, but what it means is you're not shedding the lining inside your womb that often. So if you're not shedding it regularly, then that tissue, the endometrium we call it, can thicken up, and that can potentially cause a risk factor for women's health later on in life. So menstrual cycle is probably the biggest, most obvious thing in PCOS. When you have irregular menstrual cycles and you think, oh, is this PCOS related? Secondly, is when I mentioned testosterone, so the androgens are raised. And again, a lot of women with PCOS have this. Not everybody does, but um, it can be raised. And that leads to things like acne, so skin changes, having greasy skin, having excessive hair growth, so darkened facial hair perhaps, or even hair loss, but then hair loss like male pattern kind of hair loss. So these are kind of more appearance, kind of obvious ones that women may complain about, but also weight issues. So weight can be a big problem for women with PCOS because of other hormonal changes. So weight can be deposited, which we're going to talk about in the place that women don't want it to be deposited. And then the third one, as I said, is the imaging side of things. So that women won't know unless they go for an ultrasound. And actually, it's not that accurate because it's estimated about only a third of women will show this on ultrasound. And what we tend to have in our ovaries, and that's, I think, where the term comes from, polycystic ovarian syndrome, because on ultrasound scan, we can see multiple little follicles, which they're kind of called cysts. They're just follicles. They're part of our ovaries. And what these are underdeveloped sacs where the eggs develop. So in PCOS, we just have multiple follicles, more than what we would normally see and expect to see. And it gives a classical picture for the person doing the scan. But as I said, not everybody with PCOS shows that. So, but I think that's where the term comes from. So that's how we diagnose PCOS. So two out of the three.
Great. Yeah, I think I'm going to say this quite a bit, or it just keeps popping up in my mind like, all of this information I would never have thought to have found out, or when you're younger you're taught that the basics, and it's just kind of like you just go through life like a little bit like this is just how it is. So this is really, really useful information, for me, for everybody watching, I would imagine, that requires or is wondering if they have it. I think this is so important.
Yeah, I think as you say, when you're young, and that's part of what I like doing is sort of teaching young women and girls as well about their menstrual cycle and their hormones, so to understand what is normal for them and what that means. Because when we get taught about menstrual cycles, we're taught like the textbook 28-day cycle. Day 1 is when you start bleeding. Usually by day 7 that has stopped. Day 14 you ovulate, and then it all happens again 28 days later. What happens when you've got PCOS? You don't have that. So as a young woman, you're going, is there something wrong with me?
Mm.
What does that mean for me hormonally? Why, will I be able? These questions come in your mind. Will I be able to get pregnant, etc.? How do I avoid pregnancy? Do I need to take will certain hormonal contraception affect me? All these questions come about, and usually quite often women don't find out until they get to a point where there is a problem.
Yeah.
So in private practice, it's all about being aware and being kind of more proactive.
Yeah, absolutely. Okay, so we've touched a little bit on the symptoms, but yeah, so what are they and how can they potentially affect quality of life?
Yes, so I mean, as I said, the irregular menstrual cycles. So what tends to happen then when you do have a menstrual cycle, so you do have a period, they can be quite heavy and prolonged. So that's quite significant, and that's not to be kind of underestimated how much that affects quality of life. So if you have a really heavy period and that lasts for a very long time, more than just a few days, you feel drained.
Mm.
You lose a lot of blood, but also energy wise, and it can affect whether you can go out to work or school or do what you need to do and function. Some women actually have to stay at home. Also, the absence of having regular cycles, as I say, that will affect fertility for some women, not all women, because there are many women with PCOS that have no problems getting pregnant, but it just might take them a little bit longer. But again, that will have a huge impact for them in a relationship or not in a relationship when they're planning a pregnancy. The testosterone side effects, so a skin condition, hair issues, that usually has cosmetic um, effects on quality of life. So how you look, that can affect you. The weight, particularly finding it difficult to get the weight that you want to get at, that will affect you emotionally and mentally as well. And quite often, women with PCOS struggle with psychological symptoms, so feeling kind of low mood changes as well, and body image issues related to PCOS. Um, and so there are numerous different symptoms that can affect the quality of life. And I think it's just being aware that you can do things to alter that and change that and make yourself feel better.
Yeah, absolutely. There's no shame in feeling, oh, I should just accept it. There's no shame in wanting to get those things fixed. Absolutely. So one thing that I found that seems to be we've referred to just before as well, and that seems to be quite a common kind of like talking point is PCOS belly. So what is
Mhm.
that, and does it always show if you have PCOS?
Yeah, I actually, as a medic, it's not a term that I come
Oh,
across, obviously, in my
okay.
clinical work.
Yeah.
It's not something that we use for diagnosis or
Mm,
management or in our
mm,
clinical kind of, we don't have
mm.
textbooks now, do we? We've got online material, but,
Yeah.
classical textbooks. And it's when you start seeing patient information and what's out there on social media and you have PCOS belly. Yeah, okay, that's what they call it. For us, it's just depositing the weight in the what we call the abdomen, so the tummy area, and we call it in medical terms central adiposity. So it's just having weight around the waist
Mm,
and the abdomen really,
mm,
and quite often the weight can deposit not just superficially. But also deeper around the organs. And from me, from my point of view, that's really important because that increases the risk for cardiovascular disease. So if you have that, that puts you at higher risk of heart issues later on in life. From a woman's point of view, you're obviously looking at a body image and you're obviously wanting to reduce that. But I'm saying it's also really important for your health
yeah.
to try and do something about that. Um, but basically, what happens, we talked about the insulin resistance, and then fat gets deposited in that area
Mm,
because insulin over time being a bit elevated, there's a resistance to it. Glucose runs a bit higher, and then the way we deposit our kind of fat is in the kind of wrong areas. Um, Also, with cortisol, sometimes we have higher stress levels, particularly in our modern day life. Again, that can deposit in the wrong places. So it can deposit where we don't want the fat to deposit. So PCOS belly is really carrying that weight in
mm,
an area that we really trying to reduce. And that can also happen with testosterone and the androgens. They're more, I'm going to call them male type hormones. So again, they tend to deposit weight in that area rather than in the classical female
mm.
way, which is more hips and
So,
bottom.
is it possible to lessen symptoms like PCOS belly? And can the condition completely go away?
Oh, that's a good question. So the question about, what can you do about PCOS belly and that weight and that, I wish I had a magic wand
Mm,
or a magic pill just to make that disappear, not just for PCOS, but for lots of people who struggle with that weight. Um, in answer to the question, will it go away? No, unfortunately, there's no cure. It's a lifelong condition that, once you're aware of it, you learn what to do, how to manage it. So unfortunately, it's a lifelong thing that will always be there. Um, but the key thing for weight, and I know that everybody hears this all the time, is really lifestyle. Okay. There isn't a magic tablet that I could give women and just say, here you go, that weight will just redistribute and this will just all change. So it's really important. That's why you might see people like nutritionists and dietitians who specialize in hormonal conditions, so particularly PCOS, so they can take that women through advice on how to concentrate on their diet, having I have to say, be careful though, because it has to be a varied diet, no restrictions of everything. But it has to be the healthy kind of eating habits that have got to be established to optimize not just the PCOS, but your like overall health. So it's looking at, eating um, lean kind of protein, eating plenty of fruits and vegetables, making sure that you're not eating an abundance of processed foods. You're eating more natural, kind of healthier diet, but also exercise. So making sure, again, exercise, we say, oh, you should just exercise. Well, how do you do that? Again, that is very individual.
mm,
It's what you enjoy doing. So some people enjoy walking and nature. Some people enjoy being in an exercise class. Some people like shutting themselves out of the world by doing gym work, that kind of thing. So to each their own, but find something that allows your body to move, because having our current sedentary lifestyle is kind of not going to help shift anything.
Mhm.
So we need movement, we need diet, but also from I mentioned the psychological symptoms, making sure that you do things to relax. So, whether it's meditation, whether it's some other kind of relaxation techniques, breathing techniques. Again, we want to bring cortisol levels down, because the cortisol levels too high will also deposit the weight in the wrong areas. So, it's a combination of lifestyle things to do to maintain your body health. So it's doing it as a whole grand picture. Obviously, from my point of view, I look at hormonal treatments and hormonal medications to help, but that's really to minimize any issues for health conditions that could develop, allow the body to menstruate or not menstruate, keep that lining thin. Look at diabetes point of view, cardiovascular. I look at it from a very medical
Mhm.
aspect, from what I can intervene and
Mhm.
do. From a woman's point of view, it's about what she can do,
Mhm.
about what changes can she make to her lifestyle, to minimize any kind of long-term health issues and keep the weight down. And actually, um, I'd read somewhere that losing about 5% of the weight actually significantly improves the symptoms itself. So keeping weight down and within a healthy range itself already significantly improves the PCOS symptoms. But how to do that is a lot of hard work.
Absolutely, a lot of commitment, but it's really good to know that people like you are out there to support. How is PCOS treated, and can it lead to serious issues if it's untreated?
Yeah, so PCOS is treated. So, as I said, key thing is lifestyle. That's the first thing to
Mhm.
focus on. I always tell women, focus on your lifestyle. That's something you can do now, something you can address. It's not easy when you have to shift habits and changes, but once you've made the changes and keep going, it suddenly becomes second nature to you. Secondly, looking at medical interventions, we look at very typically as hormonal contraceptives with estrogen in them. So there's a huge different variety of different types of what we call combined hormonal contraceptives. But the idea is that the estrogen in there will kind of help reduce the androgen testosterone symptoms. So using something with the estrogen to help the skin, help the hair, etc., but also help with the lining inside the womb and the menstrual cycles. So we can use hormonal contraceptives that way. And when I say combined, it's got the estrogen, but also usually another component, type of progestogen, but they can be what we call less androgenic. So we can choose a combination with something that kind of reduces the amount of testosterone kind of side effects as well. So most common is something like a combined contraceptive that is very typically used in younger women. Um, Other than that, it's looking at treatments for fertility. So looking at, if you don't want to be on a contraceptive because you're planning a pregnancy. So it's looking at medications like clomiphene, perhaps to stimulate ovulation. So that's usually when women go and see a specialist, fertility specialist, to diagnose the PCOS at that point, as we talked about. But then they can get something like clomiphene to help if that's what's thought would be a good option. But also something called metformin. And that's a medication that's used for diabetes, but so it helps regulate the glucose. So that's quite often a medication that's used for women who don't want to use a contraceptive, but want to help regulate the PCOS, and still perhaps try have a pregnancy or not. Those are kind of the typical
Mhm.
medications. I mean, there are other treatments. They're more specialized, more complex, and they usually involve a gynecologist who will, for whatever reason, you need to go on that. Those are the treatments that would be offered to you. So it may be a treatment, as I said, for fertility, but it may be a treatment because you're having issues with the lining inside your womb, etc. So
Mm-hmm.
it kind of depends on the individual case. So the very simple thing to do is a combined hormonal contraceptive and looking at the combination. And then there's things like metformin, clomiphene, etc. As sort of next levels. Um, and then you get medications depending on, if there is diabetes, if there is a cardiovascular risk, is there what we call lipid profile? So we're looking at cholesterol. Do we need to look at that? And that's more typically, classically, sort of the older kind of, I don't mean old women, but just, as you get older, the risks naturally go up anyway. So we may need to look at adding in other medications to reduce that risk for heart and lipids, so cholesterol, and for diabetes.
Great. It's really good to know that there are different options out there depending on the severity or people's ages and things like that. That's really good. So, oh, well, you mentioned before, it is a lifelong condition. And I had a question, which was, does it go away with menopause? I guess that's not the case, but can the symptoms lessen with menopause, maybe, or?
It's a good question. So PCOS, it doesn't go away with menopause. What goes away is that one kind of presentation or that one criteria, which is menstrual cycles. When we talk about irregular menstrual cycles. So what menopause is you stop your menstruation. So obviously that disappears after menopause. But the hormonal changes are still there. So the risk factors are still there for diabetes and heart health, so cardiovascular health. There is a natural decline anyway with testosterone levels in all women, but again, it may be at slightly different rate for women with PCOS. That I don't think there's enough evidence to show, but sometimes women with PCOS might find that they have very similar symptoms anyway because of that imbalance. So their estrogen, although when you do a blood test level, the estrogen may still be within normal range, but because their testosterone is a bit elevated, they can still feel like they've got similar symptoms. So lack of energy, irregular menstrual cycles, they may feel mood changes, etc. So these also overlap with menopausal symptoms. So sometimes women might find that it makes it worse. So that now they're having in perimenopause, which is when the hormones start fluctuating before the periods stop. So if you're already got kind of hormonal imbalance there, and then you get really drastic fluctuations in the time of perimenopause, then the symptoms that were there already may be exacerbated, may be much more severe for some women. Or they may find it actually doesn't bother them too much because they're used to it. Because you're used to all those hormonal changes anyway. So again, I think it's very individual. So it can actually make it worse. But, other women I've seen say, well, I've dealt with this all my life. So, I can deal with this change too. The crucial bit, though, to mention is that, as I said, after menopause, the problems don't go away. So the insulin resistance is still there, the cardiovascular risk is still there. And so it's really important, particularly around that age, to monitor, maybe have an annual check or, every 2 years having your lipid profile and your glucose, whether that's your glucose exactly, or something called HbA1c checked. And it's just making sure that you monitor your blood pressure as well, because that's also quite key in cardiovascular conditions and health. So just having an annual kind of check to identify any kind of early changes
Mm.
when you get to that point is really important.
Great. That's really, really useful to demystify that, because I think that's something that might be a thing on the internet that, oh yeah, if I've got the menopause, it'll go away. But that's really interesting and useful, definitely. The final question, how can you consistently feel better despite having PCOS?
Um, Consistently feel better despite, yeah, that's a difficult one to answer, because it comes back to the lifestyle
Mm,
and looking at all the different factors, because um, it depends on what is the most. This is what I do in the consultations, trying to figure out what it is, what do you want to focus on at that moment in time. So everybody's slightly different as to what would make them feel better with PCOS, in my opinion. Because as I've said, somebody might be actively wanting to try for a pregnancy, so that will be their focus, on making them feel better to achieve a pregnancy, a successful pregnancy. Um, Other women, it will be because of the testosterone side effects, so the androgenic effects. So it may actually be looking at cosmetic management to make them feel better without having that darkened hair growth. Using skin specific targeted skin treatments for acne and things like that, and that might help boost body image. To make you feel better could be using something like the combined hormonal contraceptives, and that could be again to kind of boost the estrogen side of things and try and minimize the androgenic side effects. Also, from my point of view, is really important for the lining of the womb, and keeping that nice and thin to prevent that buildup for later on, potentially causing a risk factor for a condition called endometrial hyperplasia, which is an excessive growth. Um, in saying that, I keep harping on about combined contraceptives, hormonal contraceptives, and saying they're usually our go-to and our key sort of treatment options. But not everybody wants to have hormonal contraceptives, and not everybody can because of health risks and associations with that. So somebody with migraine with aura, for example, might not be suitable for that. So then it's a discussion about, what other options could be kind of second line to help. But it's really about making sure we don't make things worse. So again, hormonal methods can potentially cause side effects, such as mood changes. So which you've already got, perhaps with PCOS. So it's that balance. And then that's why I say, come and see somebody like me, come and see somebody who knows more about the different hormonal methods to see and adjust what might be the best option for you. So it's working perhaps with someone that you know, someone that you trust. It might be your GP, it might be actually a person who's a dietitian or nutritionist who actually helps women look at the diet things, but also can advise about well-being. It might be the holistic practitioner, but as long as it's safe, and it helps you along your journey to make you feel better. I think the key thing as well is finding support, and finding the support that you need from other women going through it. And so there are lots of support groups in different areas in the UK. We've got Verity PCOS, and we've got other ones. In fact, actually, I joined a group in France to try and promote and encourage PCOS in France as well, because I think it just using more of us to talk about PCOS and raise awareness more women will find other women going through the same thing.
Mm.
So I think a very important bit is understanding you're not alone,
Mhm.
and recognizing that there are other women going through the exact same thing as you. So having a lot of support from a network. But I would always say be very aware that there's a lot of information out there now on social media that may be not correct, maybe just wrong information. So it's
Mhm.
always going to the right sources
Mhm.
for your information and your support group as well. So again, if you go to a specific online support group, which then has maybe promotes information that's not correct or not safe, I wouldn't encourage that. So I would always look for recognised support groups with attached information by medics who've checked the content. So, Verity PCOS is in the UK, but just making sure that you go to the right information. If you don't know where to go, you can contact people like specialists or your GP to ask where the right groups and where the right information is.
Absolutely. I think it's really important to know that there is support out there, and it's not to kind of point you in the wrong direction, but there is some out there that can. So just to be aware of the differences and where to go. That's amazing. Great. Okay, well, thank you so much for joining us today, Dr. Knoops. It's really, really amazing to hear all about this condition in detail, expert detail. Um, yeah, so thank you.
Well, thank you again for allowing me to share the information, and feel free to ask any further questions if you want to come back to me about any hormonal condition.
Fantastic. Okay, so if you're looking for expert PCOS treatment, arrange an appointment with Dr. Knoops via her profile at topdoctors.co.uk.